We continue discussing the emotions, and we go to part two of sadness and grief. We have here a case history of a 40-year-old woman who was under a great deal of stress due to her divorce, which caused her great sadness. She often felt weepy, she felt aimless, and questioned her role in her relationships with men. She was at a turning point in her life and did not know what direction to take. She slept badly and her pulse was choppy. This is a clear example of sadness affecting the liver and therefore the ethereal soul. She was treated and improved tremendously with the yin linking vessel or yin wei mai points, pericardium 6 on the right and spleen 4 on the left, and bladder 23, bladder 52, and bladder 47. Dr. John Shen considers that grief that is unexpressed and born without tears affects the kidneys. According to him, when grief is held in without weeping, the fluids cannot come out in the form of tears, and they upset the fluid metabolism within the kidneys. This would happen only in situations when grief had been felt for many years. Sadness and grief are very common and important causes of disease in Western patients, much more than anger. Anger as an emotional cause of disease is overemphasized in Chinese books. What causes sadness and grief in Western patients? Apart from the obvious causes such as bereavement, very many Western patients of all ages suffer from sadness and grief deriving from the breakup of relationships or marriages. In other words, sadness and grief are primarily about loss, whether it be the loss of a dear one to death or the loss of a partner through separation. It is very important to remember that chi stagnation affects not only the liver, but especially in emotional problems, also the heart and lungs. Sadness, grief, and worry are common causes of chi stagnation affecting the lungs and heart. For example, in women, lung chi stagnation affects the chest and breasts, and in the long run, it can give rise to breast lumps, which can be benign or malignant. In Western women, this is a more common cause of breast lumps than liver qi stagnation. Dr. Xia Xiaonong thinks that breast lumps and breast cancer are due to sadness and grief deriving from widowhood, breaking of relationships, divorce, death of one's children, and bereavement at a young age from the death of one's spouse. These events, especially if they occur suddenly, upset the mind and lead to chi stagnation and chi depletion. It is interesting to note that all the events mentioned by Dr. Xia involve separation and loss. To summarize, sadness and grief affect the lungs and heart. Sadness and grief deplete chi. Sadness often causes a pulse without wave. That is, the pulse lacks a flowing movement from rear to front position, and it is instead felt as if each individual position were separate from the others. In the case of sadness, the pulse lacks a wave in the front and middle positions. Sadness and grief deplete chi, but after some time, they also lead to stagnation of chi. In some cases, sadness injures the liver. According to Dr. John Shen, grief that is unexpressed and born without tears affects the kidneys. Sadness and grief often derive from the breakup of relationships or marriage. Thank you for your attention.